My name is Buford McFadden Salafi. My Yupik name is Arik Ralra, which means money spender. I am half Yupik, half Irish, born and raised here in Alaska. My use of MAT, M-A-T, or medically assisted treatment is naltrexone, and it's a antagonist, I guess, for alcohol and opioid use disorders. My recovery before medically assisted treatment was a little rocky. It kind of revolved around me trying to power through things, going to different recovery groups, and weaker for not having been on it. I was first introduced to medically assisted treatment through a treatment facility that I went to down in Juneau. And then, through some mental health care professionals and through my physician, and also through counselors at different treatment facilities. So when I was first introduced to MAT, I did have hesitations about it. With my body already suffering, from my alcohol use disorder, I was worried about the side effects, the possible side effects that MAT had, and that sort of kept me away from it. But with more information, with my body sort of healing and my mind becoming clearer, that hesitation went away. It plays a part in my recovery in just that. It's just a part of it. My recovery as a whole is a bunch of little different pieces, and medically assisted treatment is just that. It's a piece that I found that was missing, that I didn't know about. And it plays an important role because I know what it does to help me. I know what the effects on my body are now, and it's something that I'm not willing to give up because I don't know if that's the piece that's going to send me over the edge if I quit practicing it or not. And I'm not willing to take that risk today. My friends and family were very supportive of my use with MAT, but it's important to note that the type of MAT that I'm on, naltrexone, is not something that can give you a sense of euphoria or a sense of a feeling of being intoxicated or feeling, mentally changed. So I think that had a large part to play with my friends and my family being as supportive as they were. That it's not as bad as people make it out to be. It is a tool. It is something that can play a vital role in people's recoveries, and that it's not as bad as people make it out to be. Also, I wish that people could get more information about the positive side effects from actual interviews like myself from people that are using MAT, that the juice is worth the squeeze. Any sort of negative side effects that it may play on my body from using MAT far outweigh the possible negative side effects of me going back to my old, using and drinking lifestyle. So I'm a half Yupik, half Irish Alaskan native, and my native culture just most recently has played a very vital role in my recovery. My native culture teaches me, most importantly, to respect myself and others, and I can't do that appropriately when I'm using. And with MAT, it helps me to stay focused on my recovery so that I can get back into the practices, of my traditional culture. and it helps me to keep a more healthy mindset so that I can make healthy choices. Some traditional healing is not in the sense of generally taking medication or any sort of herbs or natural homeopathic medicines. My traditional healing comes from attending, native dances, taking a maqi, which is a steam bath, but with generally other men that are mentoring men. Another thing, subsistence lifestyle. It helps me to stay focused on the fact that I need to remain sober and I need to remain in recovery, because if I'm loaded, drunk, high, or whatever, I'm not respecting the land. I'm wasteful, and to be honest with you, I just don't find the motivation to partake in those traditional healing practices, because I'm stuck in the old lifestyle where all I'm looking out for is myself, and not in a good way. The possible negative side effects of using MAT far outweigh the inevitable negative side effects of me going back out and using. Something else to think about for these folks is that there isn't just one form of MAT. There's multiple different medications out there. There's multiple different options out there for people to use. And I would encourage folks to do their own research, get on message boards, talk to their physician, their primary healthcare provider, talk to their counselors, talk to their therapists, talk to their psychologists, and to try to seek out people that are on MAT, that have a history with using it, and to try to ignore all the hype around people that do possibly misuse or do not use appropriately the MAT that they're prescribed. The other thing is that it's not as scary as the informational pamphlets make it out to be, with the long list of whatever the side effects might be, and that if nothing else, give it a shot, because why not? So being in recovery has really improved every aspect of my life. The one thing that it put a huge hindrance on was my using, and but that's kind of the point, right? Like, to be in recovery for me means to have a life. I'm employable today because of my recovery. I'm trustworthy today because of my recovery. I get to experience life today because of my recovery.